There is a lot of hype over that booster shot tonight, and now the FDA says most Americans won't even need one, at least not for now. In a surprising turn of events, an influential federal advisory panel rejected Pfizer's extra dose today and instead approved it only for those over the age of 65 or those who are at a higher risk. When it comes to a large portion of the American public, though, some would argue that today's vote only adds to the confusion as how we further protect ourselves from the virus, especially amid the highly contagious Delta variant. The U.S. averaging now about 150,000 new COVID cases every day. ICU beds in some states filled to the max, and many of those patients unvaccinated, according to the data. Dr. Amish Adalja is a senior scholar at Johns Hopkins University Center for Health Security, and he is joining us live tonight. Doctor, you said that you would have voted no as well to approving the booster today. Why is that?
Because when it comes to what the vaccines were designed to do, preventing serious illness, hospitalization, and death, there's no evidence that we've seen any kind of erosion in the ability of the vaccine to do that for the general healthy population above the age of 16. So on that specific question, the vaccines are doing well. So there's not really a threshold been crossed for needing a booster. And that's why I would have voted no, just like the majority of the advisory board members did.
Yet the president came out not too long ago and said we need a booster. So that further complicates and confuses people who already are not sure what exactly we should be doing. So how do people interpret this information tonight and make the best decisions for themselves right now?
It's very confusing because we usually don't have the White House getting ahead of the science, getting ahead of the agencies that are tasked with deciding things about vaccine policy. So I think this is a mistake in hindsight for President Biden to talk about this before the actual work had been done. And I do think it's added to a lot of confusion for the general public. So what I would say is if you're somebody that's at high risk for severe complications, and that's going to all likely be delineated a lot more next week when another committee, the ACIP, which is a committee that's convened by the CDC, meets, they're going to talk about which high-risk categories fit in there. And they're also going to talk about people that are above 65 when they should need a booster. It's probably going to be 6 months from your second dose. That's when they're going to say, if you're 6 months or so out, get your vaccine. And they're probably also going to say healthcare workers, because of the high levels of exposure they have in the day-to-day performance of their job, they're going to be getting it. But I think if you're outside of that group, and even if you're in that group, you have to realize that the vaccines are doing a really great job at keeping people out of the hospital. If you walk through hospitals, and I was working in a hospital all day today, I'll be in one tomorrow, it's unvaccinated people who are getting admitted. And that really shows you how well the vaccines are holding up.
One final thing on the boosters. Could this mean the FDA will greenlight a booster for Moderna or J&J, or is this meaning that boosters all around right now not necessary for any of them?
This was specifically a meeting today about the Pfizer vaccine. The other companies are a little bit behind in the submission of their data and need for evaluation for a booster. I suspect that there is going to be similar discussions around the Moderna and Johnson & Johnson vaccines, but it's going to be on a little bit of a delayed timeline because the companies actually have to present that data to the FDA to get the approval that they seek for these boosters. So stay tuned for those. I suspect you're going to see similar decisions made regarding the Moderna and J&J vaccines in the coming weeks.
Doctor, we hear about the states in crisis mode right now with cases surging. How worried are you that we're going in the wrong direction based on what we're seeing right now as we head into the colder months?
We definitely went in the wrong direction solely because we don't have enough vaccinated people in this country, especially in some of those states in the South that got hit hard. And now we're hearing about states like Idaho getting hit hard as well. And it's really something that's self-inflicted. It's completely preventable. COVID-19 is now a preventable cause of hospitalization, a preventable cause of death. And what's happened is many people who chose not to be vaccinated ended up getting infected and then really presenting at their hospitals to need care. And those hospitals cannot do this forever. They have fixed space, and it's become very, very difficult and challenging. And none of us thought we would be back in this situation again in some parts of the country because we thought that the vaccine rollout would go much better than it did, that we would find people eager to take this vaccine. And unfortunately, some high-risk individuals clustered in certain states chose not to do so. And it's really a frustrating situation, and it definitely has set us back in this pandemic. And it's the worst part of it is that it was something that could have been completely avoided and prevented if more people would have just taken the vaccine.
And here we are. Dr. Adalja, as always, thank you for your time.